evening and welcome. I'm Olu Phillips. We begin tonight's program with an acknowledgement that not everyone who wants medical attention right now from public health institutions can readily get that. And as you well know, the industrial action by the Nigerian Medical Association has entered day 2 with the impact already growing. The NMA President, Kayode Obembe, was emphatic when he said that the decision followed the expiration of the 2-week ultimatum he gave the federal government to meet its 24-point demand. The contemplation here is the drive to improve health care, and somewhere in the 24-point demand, wait for this, is this worry about really how many captains they should have in a ship. The title consultant in a hospital setting describes, I'm quoting the NMA right now, the title describes the relationship between the specialist medical doctor and his patient. It will be a source of confusion, they say, if that title applies to any other health worker who statutorily does not own a patient. Disturbing as that may sound, I got 2 guests in the studio who are on opposing side and have opposing views on this latest development. We'll take a short break now. When we return, I'll introduce my guests and we'll get rolling. This is Face Off. Welcome back. This is Face Off. We're talking health today, day 2 of the Nigerian Medical Association strike action. And the question on the lips of many, but on how much of patients' needs were taken into consideration before this action. And what about those that may fall ill in the course of this strike action? How many will be responsible? The responsibility, should it fall on the NMA to have considered all of this, or should government quickly do what they need to do and make sure that these guys get back to work? I have 2 guests in the studio. To my right is Dr. Majolagbe Olayinka. He's of the NMA.
Yeah, nice to meet you.
And to my left, I have Mr. God Bless. Mr. God Bless Otubore is a human capital development, human resource capital expert, and you're here to look at a slightly different direction from what the doctors are saying.
Absolutely.
I'm going to start with you, Mr. Doctor, if you permit me, to ask you to tell us why everybody or anyone who is sick at this point and needs to go to the public health can get your services. In your opening statements.
Well, let me start by saying that when you read Dr. Kayode Obembe's speech and said that this strike has been declared after 14-day ultimatum given to the federal government, that's actually been anecdotal. It's actually been declared after several years of negotiation, after several years of calm, after several years of actually going by the way of dialogue. And it has become obvious to the NMA that the issues on ground are not being realized. One thing I want to let the general public know is that it is now 7 years, 2007 precisely, was the last time the NMA at the national level declared this an action like this. So for NMA to be coming up with something like this, that means it must be something very, very serious and something very important.
Otubere, opening statements.
All right. He said something about the fact that it's a culmination of a lot of years that has led to what has happened in July. But if we look at what we have out there, what Nigerians know is the fact that they gave the government a 2-week ultimatum. If you ask the guy who is watching today or the guy who is reading papers, he won't say that they've had conversations with the government for 7 years, what the doctor is saying. But I'm saying that it's a funny situation that we'll find ourselves as a country.
What direction, really, if we need to start,
what
direction do you think we should be going that isn't where this people and his, Mr. Taufik and his association is going?
I knew about this. I read it, and first thing that comes to mind is, as a human capital development expert, you look at the effect of the doctor's action on the larger economy. So the doctors are going on strike because they have 24 points, they say end points, that's what they call them, for the government to resolve. And I'm looking at it that, is this the best thing to do at this time?
I'm going to have to take you on from there. I'm going to take you on from there. You see, you said everybody had this 2 weeks ago.
I mean, that's what is in
And
the
there's-
papers. Am I lying?
Okay, fine, that's what the papers,
Okay,
but I can
great.
assure you that whoever heard that 2 weeks ago did not just wake up 2 weeks ago to situations. Last year, just last year in this country, on this same issue, NMA has had to postpone a strike on 4 different occasions.
But you know, there was a planned strike here, January 5th,
January, it
January
was
5th.
also being postponed. So something is clear there.
Some demand
very
was met.
clear there.
A demand was met.
Absolutely
A demand
not.
was met.
Absolutely.
No, a demand
okay,
was
can
met.
you give me one
I'm
demand
gonna
that
give
was
you,
met?
yes, absolutely, and I'm going to share that with you.
You see,
because,
when you keep,
no,
when
just
you see
hold on.
NMA in a posture
No, just
that
hold
we have
on.
postponed a
Can
strike
I say it?
four
No, can I
times
say it?
in the last 1 year on these issues,
Mr.
something
Taufik,
is
can I
clear
say it? Can I
that
say
NMA
the
is
demand that
actually
was met?
been trying to approach the path of dialogue.
Can I say it?
But you see, you
Can I
get
say
pushed
it?
to the wall.
No, can I say it?
Everybody keeps saying that strike. Nobody is saying that it is illegal to go on strike. Absolutely, I'm not going to find one person who. I'm not going to find one person who will say that.
You know
But
what
people
we're
keep saying that strike
you know
should be
what-
what
you know what we're
last
looking at?
resort.
Dr.
I want to
Taufik,
ask you
what
this
do you
question.
looking at
see
is this.
differently?
And
Because if they have done this,
I'm going
push this for 4 times.
I'm just going to ask the
in the
question
last
when we
year.
talk about
He's
last
pushing
resort.
it. He's pushing it.
Wait, I'm going to
He's
ask the
pushing
question
it.
when you talk
He's
about
pushing
last
it.
resort.
No,
I want
no.
to just have
I
this
said
question and ask you
something
behind the
before
scene.
you wanted to ask the
If
question.
you had an issue,
Now the
if you had
question
an
is-
issue with the government
Yeah.
and you've been on that issue for 20 years, right?
Mr.
And for
Taufik,
20 years that
you're-
issue has not been addressed. Do you think it is last resort if after 20 years you're not going on strike?
Okay, can I answer your question?
Some of the
Can I
issues,
answer your
some
question?
of the issues here
No,
are
Mr.
actually
Taufik,
issues.
can I answer your question?
You got some
Can I answer your
answers? You got some
question? Can I answer
answers.
your
Let's
question?
hear the
Now,
answers.
You know, when he said you've been on an issue for 20 years, what are those issues that you've been on for 20 years?
You were trying to give us some
Yes,
solutions,
I
the things you think government did.
Yes, of course. I mean, January 5th strike action that was
was called off,
averted,
yes,
it was
averted.
because the government met the NMA's demand on the Medical and Dental Council of Nigeria's request to reconstitute that body.
Is that
I
happening?
mean, yes,
Is
the
that
governor of
happening?
Delta
Hold on,
State.
hold on.
Is that happening?
Listen,
No, no, no.
listen,
Is that
no,
happening?
wait.
No, let me
I
get
must
something
finish.
clear.
Okay,
The governor of
You
Delta
obviously
State.
does not
The
understand
governor
issues.
of Delta State.
let's
The
hear
governor of
the
Delta
issues.
State, who is also a medical doctor,
Yes.
in the person of Dr. Emmanuel Uduaghan, played a key role, and he said it emphatically that
Yeah, I think he negotiates on behalf of government.
he prayed that there should be no strike anymore because the country is currently undergoing a lot of stress, a lot of pressure, economically and socially, politically, and he's not even praying that any of this strike will come again. That is why the government met the demand. Now, what Mr. Taufik is trying to paint towards is the fact that, hey, Nigerians, the NMA has been on this issue for 20 years.
No.
Do you understand?
You're not going to.
What I'm saying.
Let me give you
what
this
no.
information.
I'm not quoting
Hear
you
this.
wrong. I'm saying
Last
that's what
year,
you're selling to us
last
right
year,
now.
January, there was NMA organized a health summit.
Okay.
Dr. Uduaghan actually hosted the NMA.
All right,
A beautiful
great.
one, and we
Great.
talked about issues that were germane to the health of the common man. We're not talking about the issues of the doctor or NMA.
I know, we're going to look at your
now,
4 points.
one of the take home from
Yes.
that summit was
Yes.
that the doctors would not use that option of strike. That strike is not going to be on board.
Okay.
It is sad that
great.
just within 12 months, 12 calendar months, this NMA is being pushed to the wall to take that same path.
Can I ask you a question?
Now,
This is a question I wanted to ask. All the question is, if you were the president, Mr. Taufik,
Yeah.
right?
Yeah.
You're representing enemy.
All right.
If you were the president of this country,
Yeah.
the 24 points that you have raised, that must be met before this strike is called off.
Yeah.
Do you think, if you were the president, you would sign?
No, let me give you this information. It's obvious. I'm going to ask you this question, and it's probably obvious that you don't know what it is.
Okay, I'm listening.
I'm
Let
going
me
to
go
inform
on.
you,
Here.
and for the purpose of the general public,
All
for
right.
all Nigerians,
Yeah.
you see, NMA, this is a very different strike that we are on.
Okay, go on.
Right now, there are two things the NMA is really pushing. One, we are actually defending the soul of our profession. That's
Okay.
number one. If you are
Okay.
a professional who's the highest rated anywhere in the world,
Okay.
I'm sure for the sake of posterity, for the sake
And
of
that's for
you will do
that's for
everything
the
to
Surgeon
defend it.
General
That's number one. No.
and
You
the
are
issue
not
for
getting it. You are
consultants.
not getting it. Hold on.
Right?
The second thing is this. The NMA is also making sure that we protect whatever it is that is left of the health system of this country.
Look at it.
Because I can
Look at
assure
it.
you,
No, look at it.
the
What
issues
you're
on
saying
ground,
is
these
does
are
not want
issues.
any other person that is not a medical doctor to be called a doctor.
I want to ask you this question.
That is what you're
I want to
saying.
ask you this question, Mr. God bless.
I'm going to
I
bring
want to ask
something
you
to
this
you.
question
Do you
in
know?
a ship. I want to ask you in a ship.
Yeah.
How many captains do you have in a ship?
One,
When you have two, what happens?
there's chaos.
I think that's commonsensical.
What is the problem?
You believe so?
If
Now you
NMA
see,
saying to Nigerians,
the return for an hierarchy in medicine is to ensure that ship
we are going on
does
strike
not
because
capsize.
there are two captains.
No, you get it. Let me get it right. Okay,
I'm putting it
now let
back
me
to you.
educate you. Let me educate
The issues
you.
you're raising.
No, let me educate
I know.
you. No, okay.
I know.
Okay,
I have
on
read
the
on
issue
it.
of
I've read on it.
consultants.
I mean, Soldier
Okay,
General is one of the issues. They want the president to appoint a Soldier General immediately. It's part of their 24 points.
Do you know that there used to be a Soldier General in this country? You know that.
What happened?
Do you know that?
What happened?
After the Civil War, that was scrapped. Politicians came in, and that since then, since after the Civil War, NMA have been agitating for this position.
I have a question for you. I have a question for you.
More than that. That's how many years ago? Now, let me tell you something now. This issue, hold on, hang on. You're going to listen so that other people can benefit from this. Now, you see this issue of consultants, other consultants in the health sector. Number one, that we have already seen, I mean, it's commonsensical that you don't have more than one captain. Let me explain to you.
I'm listening.
As a public person, you are in human resources. You can be a consultant to anybody.
Absolutely.
Right?
Yeah.
Anybody can be a consultant to anybody.
Yeah.
But in the medical sector, it is completely different. Especially in the hospital setting. The word consultant, go and check it in the encyclopedia, go and check Wikipedia, any link that you check. A medical consultant is a specific word. And that word refers to a doctor.
Okay.
And I'm going to tell you why. I'm going to tell you why. I'm going to tell you why it refers to a doctor. I'm going to tell you why it refers to a doctor. Right? It is not just because we prefer to be there.
I think
but
there's
it is because it is important. No. So
let me intervene here. Let me intervene here. Why you think there's an ego trip journey that is being embarked here by the Medical Association of Nigeria, which borders on who should be called a consultant or not? Hold that. I'm not saying that's right or wrong. But for you as a human capital or human development expert and all of that, what is your take on this incessant, whether be it strikes that are called off and later come back, and if two people have an agreement, according to what they are quoting, since 2009, and you sign off on it, I sign off on it, does it behove on any of the party to relent on it?
Okay, now, let me answer. It does not. One, if we have an agreement, if I sign a contract with you, I am under obligation to fulfill it.
Absolutely.
Now, let me tell you one thing. I'm not speaking for the government.
Okay.
We're looking at how these issues are. The question is, if all the demands of all the different sectors that make up the national economy bring their paper to the table and say, this is what we want, do you think we have enough resources to meet all their demands?
I'm going to give you this information. You see, there's no government.
So you think,
no single government.
Why you're pushing for a point? Why you're pushing for a point? You're thinking, are you saying, why you hold your point?
Why you agree with you? But you know what you're going to have to know is that there is posturing. It's very important. If I sign an agreement with you, hold on, Mr. Hang on. If I sign an agreement with you, Mr. God bless, right? And I say I'm going to get this done. Posturing is important. And then I go somewhere else and sign exact opposite agreement with somebody else. What does it think? What do you think it means?
Are you invariably saying that the government
has signed? I'm going to give you an instance. I'm going to give you an instance now.
Want to hear that.
The deputy CMAC in the hospitals, right? There used to be only a CMAC. The government secularized the positions of deputy CMAC. It is already operational. Okay. Right? These are people who are supposed to assist the CMAC.
Is there any politics? Is there any
Now, listen. Let me land. Now, this